Welcome everyone to the Aroostook Colorectal Cancer Awareness webinar. We are thrilled to have you here with us today, and we're so glad that we can put these kinds of webinars out for our communities because we live in Aroostook County and weather can be unpredictable, and so it's nice when we can access great medical and health information from the comfort of our own home or on our electronic devices. So we are thrilled today to have Cindy Blanchette, who is an RN with Cary Medical Center, who will be sharing with us all about the work that she's doing through Screen Aroostook. And that is a grant-funded program that I'm sure she'll tell us a little bit more about when she begins her presentation. So without further ado, I'm going to turn things over to Cindy. If you have any questions, you are able to chat in the chat box and you can enter your questions, and if you do happen to jump on while we're here live, we'll be able to answer those questions right here while we have Cindy present. And if you're watching the replay and you have any questions, we will provide some contact information that you can follow up with Cindy after the fact for any additional questions that may come from watching the replay. So thank you for being here, Cindy.
Thank you very much. I am the coordinator for Screen Aroostook, I Count, and this is a grant that came about by the Maine Cancer Foundation and the Jefferson Cary Foundation in establishing this when they found that Aroostook County's ratio for colorectal cancer was actually higher than not only our Maine average, but also our national average when we are looking at population, and you'll see that in the slide here. Our grant's goal is to decrease morbidity and mortality due to colon cancer here in Aroostook County. And how are we doing that? We are doing that by partnering together. And we have joined together partnering Cary Medical Center as well as Pines Health Services, Holton Regional Hospital, Petardon Valley Health, Northern Maine Medical Center, and Northern Light AR Gould and Presque Isle. We're working together through educating our citizens of Aroostook County and taking that to the population that's at greatest risk, which we'll be talking about, is that 50 to 75-year-old age category. Among the cancers that certainly affect us, colorectal cancer is the second leading cause of cancer deaths in the United States. And unfortunately, the diagnosis is bringing to light about 140,000 cases here in America annually. And out of that group, 1/3 actually die from the disease. And what we're really looking at is the earlier the education, the better that we're finding for getting diagnosis made, and certainly a much better turnaround for treatment as well. March is Cancer Month, and one of the things we really are looking at is we don't want to be number 2. We want that number to be far less. So we are really, really working hard to take that number and make it something different than second place at national level. We have 300 Mainers. This is a sad slide that will die of colon cancer this year. And really looking at that age group that we are looking at, again, that 50 to 75, we have 90% of those deaths that really we believe could have been prevented through earlier screening. And that's what our goal is, to get out there and educate this population to change that number. We all know we have diseases, and as we get older, some of those diseases certainly become risk for us with the different things we are looking at. And colorectal cancer is also in the same group of diseases, and we're looking that more than 90% of those cases are falling into this older population, again, that 50 to 75 age window. And those risk factors that are higher there, we really want to work with this age group to be educated to get screened as early as we can get them screened. Precancer polyps, they don't always come with symptoms, and we go in and we get a colonoscopy, and we're probably a little surprised when we hear physicians say, I found a polyp and we removed that. They don't come with symptoms. So knowing that you do have a polyp there, you probably would only have a symptom if you saw bleeding and that brought you to the doctor initially. But a lot of them go without symptoms and are diagnosed at the time of the colonoscopy. So what are the symptoms that we can actually be looking for that would probably bring us to the doctor to be diagnosed? It may be blood in the stool, it may be blood in the basin that you see in the flush, but you don't see anything otherwise. It could be cramping, you just don't feel yourself. You may have some weight loss and you really don't know why, and you haven't been dieting. So these are symptoms that might present themselves that might bring you to the doctor. And really what I want to tell you is if you have any symptoms, you really should be seeing your doctor anyway. It doesn't mean that you have cancer. It just means that you have something that's not normal, and let your provider help you to differentiate what's actually going on. There are many screening tests out there to be looking for what's going on. And when you go looking for what is the best screening test, well, the best one is the one that the patient will do. So we have a few things that we want to educate you with, knowing what could I possibly do for screening? What are the tests that are available out there? And again, 1/3 of those people who are in this age category are not being screened. That's a huge number. And when we go asking some of these people, well, why are you not being screened? Some of the answers that we have gotten back and the doctors have gotten back, they don't like the prep. That's one thing. They don't like the test if they're looking at maybe a colonoscopy perhaps. For some people, it may be a copay. And we really want to work with the patient on how we can do things even better. What are those things to make them do the test? And I do want to introduce you to some of the tests that maybe you don't even know about that we offer. There are people who are a little bit at higher risk for developing colorectal cancer. Maybe it's a family history. Maybe you have a person who's had colorectal polyps and in the family. Those should be discussed at the family level and certainly educated to family members that that's going on so that you have that information. People who have some of the inflammatory bowel diseases like Crohn's disease, colitis in those families, those are some that your physician's going to follow you just a little bit closer with. And another one is called Lynch Syndrome, and I'll talk about that in just a little bit to give you a little more insight. And that's a lower number of people who actually get that syndrome that are at risk. So what test is the right test? Well, again, it's the one that in talking with your physician and your healthcare provider on what test would be best for you. And that certainly comes with your desire as well as the physicians on what they're wanting to do for the workup for colorectal. So these are some. One of the things you need to know, the U.S. Preventative Service Task Force actually is the one who dictates at what age those screenings become available and are given to our insurance companies. So just something I'd like to pass on, and that is we've heard in the news the American Cancer Society has wanted the age lowered from 50 to 45, and that recommendation has been passed on to the U.S. Preventative Service. They've actually done a draft at this time, but it hasn't been finalized. And I go out weekly just double checking to see if that has happened or not. When that age category does change, that will also be shared with our physicians nationwide for knowing that we will now be getting colorectal workups at a much younger age than what's presently out there that's dictated from this source. So that is actually where it comes from. And if you're over 75, the age category is 50 to 75. That's a personal basis between you and your physician. If your physician feels that you should be worked up, that he will certainly, or she will certainly, talk with you of the advantages and disadvantages for doing that workup. So these are a couple of the tests that we actually do. You may have remembered your physician taking a little stool and putting it on the little card in the doctor's office. That's called a guaiac. And that is looking for any blood that is in the stool. And again, if that guaiac is positive, you will probably be referred to get a colonoscopy done for a workup to know what else is going on there. And the FIT testing, the fecal immunochemical testing, is very direct in detecting antibodies that are in the stool. And that is one that we see advertised on TV where they say, just collect me and send me off to the lab. That is called FIT testing. And that is one that you might want to be discussing with your insurance plan to know that that is covered, and that may be an alternative that you may wish to discuss with your doctor of actually doing that testing. Another one that's available is one that's called a FIT DNA test, and that one is actually detecting altered DNA that is in the stool. And again, that's a physician choice if that's one that they would like to have you do. We have a couple of different scopings. One is called a flexible sigmoidoscopy, and that's looking at the lower third of your colon. And that may be a reason that your doctor would like to have a shorter scoping done than the actual colonoscopy, depending on what he or she is working you up for, but that's a decision. And then we have our colonoscopy, and that is one that we look at having at least every 10 years for knowing that hopefully your scope is negative and that there is no finding. But again, if there is a finding, that it's an early finding for better treatment. Colonoscopies sometimes are done more readily than every 10 years if there's a finding in there or a family history. For those, some of those we are seeing every 5 years or at the whatever the healthcare provider's decision is to do that. We also have one that's called a virtual colonoscopy, and that's where they combine x-rays with computer images of the entire colon, and that's very specific on individuals that they choose to do that for part of the workup. And again, that's a physician's choice with you. This is polyps, and we all hear of polyps and that they're fleshy. Well, these polyps actually grow right on the inner lining of our bowel. And when these surface and they're seen, they can be actually as small as a pea, or they can be as big as a mushroom. And what we really want to do is they're on that inner surface lining of the bowel. We want to get them as early as possible because they can actually venture through that wall and spread metastatically to different other parts of the body. So the earlier that we can actually contain these, and this cancer will not grow, will actually give you a better treatment plan. The earlier the better. The bottom one is a picture of a colon cancer polyp. And it's really important, again, to get in and get screened because it certainly can be a very preventative process. This is a sad slide that I have here because this is really why we became to be what we are. And we are looking at incidence per 100,000, and the fact that we are far higher. Aroostook County has 20 colon cancer diagnoses out of 100,000 population. Maine is at 16.1, and nationally, we're looking at 15.1. So we are far higher. I've had many people who've said, well, why is that? And I don't know that we actually have a why is that answer, but the big thing that is we have a diagnosis that we certainly have unfortunately had a data that is being followed for numbers. And we just now need to work at changing those numbers. We're going to talk prevention here in just a minute. This data collected was over 2010, and this is over screenings. And this is looking at not only stool-based, the guaiac cards and FIT testing, and how many underwent colonoscopies. But we really looked at the overall for Aroostook County showed 67.3 of the people who are in this age category, 50 to 75, that actually did colorectal screening. So that's a little bit lower than really what the national is wanting to see. So we have a group that's called the National Colorectal Cancer Roundtable, And they have established that they would like to see 80% colorectal screening across the board. So we had to look at how are we going to do that. So we did that by partnering together with our local hospitals, educating more that are in this group, and looking at how can we make our screening higher. And we have brochures that we have made, and also we have sent out mailers, and we've done some advertising through our newspaper and TV ads, inviting people to remember to go in to get screened with their provider. So what I want to just remind you, I had spoke just briefly about the Lynch Syndrome. And the Lynch Syndrome is an autosomal dominant inheritance that a parent can actually carry with a defective gene. And that's one that is passed on to the children, and the occurrence of that happening is about 200,000 cases a year in the United States. And that may sound like a large number, but actually it's not when you look at the total picture. But what I would like to share with you is there's a lab test available for screening to know if you're a carrier for Lynch syndrome. And that's something that you might want to just, and that's another thing that's a really important thing of talking to your family and knowing what your family history is. That's highly important. I would like to just share with you another slide. And this slide here is called Fiber 101. And I think we all have heard about fiber, and we know about fiber. And I would like to just share with you that there are actually two kinds of fiber. We call it soluble and insoluble. And they work very well with keeping your body healthy. So I'd just like to start for a second with the insoluble fiber. And it just helps things kind of move through your body a little bit faster. And it does quite a bit in the area of prevention. And that's not only through keeping us regular, but it also helps if we've gotten some things into our body like toxins, it helps to clean them out as we eat more of the insoluble fibers. And it's really big in reducing colorectal cancer. So when we look at what is actually an insoluble fiber, we're looking at our whole grain families, our beans, lentils, flax seeds, cabbages, onions, bell peppers, cucumbers, peas. What I'll say about air popcorn, don't forget what you're putting on your popcorn. That can alter certainly how healthy a popcorn actually is. Some of your dried fruits, prunes, and dates. When you're looking at soluble fiber, this is where your digestion is slowed down a little bit more, and it actually keeps you fuller longer, which is not a bad thing. And it will actually help regulate blood sugars even better, for especially if you're a diabetic. This is an area that will also help to prevent heart disease and take care of your cholesterol levels, keeping them more at a normal. So in that family of soluble fibers, we're looking at fruits, oranges, figs, pears, apples, selenium husk. I will tell you, you'll see that if you look on the side of your Metamucil bottle. That is exactly what it's made from. Your oat, your oat family, your kidney beans, your navy beans, soy products, tofu, edamame, sweet potatoes, avocados, Brussels sprouts, asparagus, turnips. So what I want to say about prevention is it doesn't only come with our fruits and vegetables. We also have to look at how much we're taking in when we're looking at fiber. The normal American actually eats about 12 grams of fiber a day, and they really need to build that up to a good 25 grams, actually double probably what most people are taking in to have a really healthy colon. At the same time, we have to be smart with our fats, our refined sugars, and our white flours. We need to work a little harder on getting healthier flours, wheat flours, oat flours, into our daily menus. Physical activity, it's something we all need to work at. We could always use a little bit more in losing a few pounds. that waistline really dictates as well where we stand with colorectal cancer. And that's an area that we just need to stay as active as we can, eating healthier as we can. Limiting our red meats and our processed foods, and really, really getting screened with our provider on a regular basis. I want to take you to one more place, and that is my website that I have. And it's called screenaroostook.com. And this is a really great website because I have testimonials that have been done by 2 people. One is Jennifer and one is Chuck, and they have been down this road of colorectal cancer, and they share their stories on our website. It also is really good in showing you, if you're looking to know if I have symptoms, what would I be looking for? You can actually look at what we have listed here on things you should be looking for to see your provider, as we talked about earlier. Our partners are listed of the different areas locally that you may want to give them a phone call if you have a question, and you certainly are welcome to even hit our contact area to send us a question. And one of the things, as I said earlier, we have brochures. And if you would like to even click on that contact and give me your information and tell me that you would like a brochure, I would be glad to mail one to you. I just want to go back to the home side because there's one more area that is really important. Let me just slide down. And that is, here is a place called Preparation is Key. And we've taken Dr. Lynn Butterly's preparation for a colonoscopy and put it on our website, because one of the things you may not realize is your colon is 5 to 6 feet long. That's pretty long. And when you're looking at having to clean a colon out to be ready for a colonoscopy, she really explains in great detail on how to do that. And I encourage you to use our website to get that information. And a couple more things. We have a little quiz on there just to educate you on what do you know about colorectal cancer. And the answers are there. And hopefully it'll give you a little more insight of maybe something that you don't know. And we talked earlier about that FIT testing, an alternative of what you can do with for colonoscopies. That information is there for that handout if you would like to click on that and review that. And statistics are on there for where we stand with Aroostook County. So what I would like to end with is just telling you we have this website. I hope that you will find it information educating to you. I would also invite you to Screen Aroostook Facebook page, in which we are posting things to educate you on pretty much a weekly basis. And you can always reach us by hitting the contact button to get back with you, in which we will be glad to do that.
Well, I had a question that came up during your webinar, and I wondered if you would maybe have an answer for that.
Anything that is taken out of the body is, the question is every colon polyp tested, biopsied for cancer, or are some considered safe and just removed? Anything that we take from the body is absolutely tested for cancer or to see what else it might be. So yes, it will be tested, and you will find out hopefully that you have a negative biopsy, or if you are found to be positive, it's an early diagnosis for treatment.
Thank you.
Yep.
Wonderful.
Thank you for joining us.
Thank you so much for being here. And again, if you have any other questions, feel free to reach out to Cindy through the Screen Aroostook website or on their Facebook page. And thank you for joining us.